So what happens in these individuals, this is of course hypothetical, who have experienced early life trauma, who have various psychosocial adversity later on. Well, there is a change in the way circuitry in the brain is prioritized. And they have high-level activity in threat and danger circuitry. They're hypervigilant. They're anxious, apprehensive, irritable, sometimes aggressive. But on the other hand, reward signaling is reduced. Well, what underlies that? In part, what underlies that is activation of inflammatory signaling and suppression of anti-inflammatory signaling is going to influence dopamine signaling. So dopamine synthesis will drop off and dopamine uptake will increase. So it will create a scenario of reduced dopamine signaling.